one thing that I worry about in the mental health, it's the mental health of the workers and the people who are left, after all of this emergency aid comes in, and, thinking about, post-traumatic stress disorder amongst, emergency health workers and communities. So I think that's an issue that we really haven't fully addressed, and, probably we'll see more and more of that manifest itself as we get, further out from the outbreak, but we haven't had a lot of experience with that.
This taps into what you were saying, Mark, as well, about the importance of the cultural factors, the importance of having the social science and the anthropology being integrated into the research we do on epidemic response, as well as the basic science, the translational science, etc. And I mean, it was really interesting, and even down to sort of how you communicate these things can have a massive impact. I mean, huge amount of evidence that during the early stages of Ebola, the message that went out in the 3 affected countries that this was incurable, that this was a death sentence, had a direct impact on the spread of the disease, because it led people not to seek treatment. It led people to not to isolate, to go and return to their families and very often infect them. And that's really critical, and we need to think very carefully about how, in these kind of situations, we're making sure that we understand all of the social factors that are leading to the spread. I mean, what was fundamentally different about Ebola was not, compared to previous outbreaks, wasn't really that the disease was any different. There wasn't some kind of dramatic mutation that had made this suddenly more threatening. It was where it occurred and what the cultural factors, whether it was the fact that these were essentially failed states with a huge history of civil war, or the local cultural factors that led to transmission, the population density, the fact that it was incredibly difficult to trace where people were going, all these sorts of things were really critical, and you've got to build that into the response.
If I could add, please. Yeah, so I think that it's a really good question, and the international institutions, I hope that we have learned a lot from Ebola. As Mark said, it's important to understand the culture, the social factors when you go into a country to support. And I had the privilege of coming into Guinea at the end of the outbreak. So actually, when I came into Guinea, the outbreak was already declared over, and I was working with counterparts to strengthen the surveillance system and do some training with some local counterparts. But then we had a flare-up. We had some new cases of Ebola. So by that time, it was the end of the outbreak. It was last spring, and the international community as a whole had learned a lot. And so instead of going in, like, we'll tell you what to do, we're going to do this, our intention was to collaborate with the community, was to pair every epidemiologist or every communication specialist with a local counterpart who explained to families like what we were doing when we were doing the contact tracing. And we were paired with families that they saw us every day, and so it built trust in those foreign people coming into their country and telling them about deadly diseases. And I had a lot of stories of just people being able to divulge information like, oh, my grandma looks really sick today, oh, I'm not feeling very well, and not being resisted. And I think those type of practices, I hope we continue them. I hope they're integrated in training for responders going forward, because that can very much take care of this. I mean, not completely. I'm not a mental health specialist. I have a colleague who is, that's over here. But that could very much mitigate the harmful effects of, just the impact and the brashness of response, how it can be sometimes. So, please.
So something that's related to mental health, but only indirectly, it's more perception, it's not really mental health like post-traumatic stress syndrome, is what the general public perceives as risk when you're thinking about an outbreak. So the people in West Africa were suffering terribly during the Ebola outbreak. We had 2 cases of Ebola of 2 nurses, one of which I had the privilege of taking care of, who got infected from the person who came from Liberia to Dallas. That person, 2 individuals got infected. 28,000 people in West Africa got infected, 11,000 died. The panic that generated in this country diverted our effort and our attention to worrying about where the real problem was. And I've seen this with the anthrax letters way back. You see it with other types of diseases, is that the American public, I guess understandably, has an issue with the concept of a new risk. And I refer to it as the relative risk phenomenon. So you live with risks that are real risks every single day. When a new risk comes in, that's far less risky than the risk that you're living with. You get panicked about the new risk. And that's exactly what happened. And I saw it, you know, we were one of the 3 designated centers to take care of Ebola patients. So myself and my team were taking care of patients. People didn't want to come near us because that there was a risk that they were going to get it talking to each other when everybody knew you had to essentially be knee-deep in body fluids. So I made the analogy, and I think they got it. I live in Washington, D.C., and we have a beltway that goes around the city. It's a very dangerous place to drive. So the chances of you getting into real trouble driving around the beltway to get to work to the NIH is about 1,000 times more risky than getting Ebola from a nurse who took care of an Ebola patient. Yet there was considerable amount of panic. So that's not mental health. That just is information that needs to put risk into its right category.
And if you think it was bad
Yeah.
in Ebola, how's it going to be when it's flu?
Right.
Oh, exactly.
Well, but also, you know, with Zika, what I worry about is where was the mental health support for all the pregnant women in Brazil who, whether they got Zika or not, for that entire pregnancy, you know, without diagnostics, they were stressed. I mean, who's helping that whole cohort of pregnant women who, you know, we have no idea what that mental anguish is like during that process?
And led to unnecessary terminations of pregnancy.
Sure.